Welcome to the podcast where we're going to work through some selected practice problems from the chapter entitled Calculation of Doses, General Considerations. And in this chapter, there are questions that require us to perform the calculations related to quantifying the dose for a patient of a drug. So, how much of that drug a patient might need. There are also questions that make us work through how much drug a patient will get based off of their dosage regimen, which basically just means how often or the way they actually have to take the medication. And lastly, there are some questions that require us to perform calculations to determine the supply of a medication needed to dispense for like a prescription. So with all that in mind, we'll get started with the first question. And first example deals with solid dosage forms, such as tablets and capsules. And it deals with a prescription for prednisone. So a little bit of background for prednisone is that prednisone is similar to cortisol, which is a hormone made naturally by our adrenal glands. Now, if you have to take prednisone for more than a few weeks, your adrenal glands tend to decrease their natural cortisol production. Therefore, a gradual reduction in prednisone dosage gives your adrenal glands time to resume their normal function. Now, the actual amount of time it takes to taper off prednisone kind of depends on the disease being treated or the actual dose of prednisone that's been used and for how long. And so it can vary. But in this question, and that's exactly what's happening. So the specifics on this question read that the following regimen for oral prednisone is prescribed for a patient. It's going to start with 50 milligrams daily for 10 days, then decrease to 25 milligrams daily for 10 days, then 12.5 milligrams daily for 10 days, and then 5 milligrams a day for 10 weeks. So that is the regimen. How are we going to dispense medications that would allow the patient to be treated in that way? Well, there's a lot of different doses that are going on over that period of time. So we're going to need to try to provide them that dosage regimen using two different strength tablets. So the question asks how many of the scored 25 milligram tablets and how many 5 milligram tablets should be dispensed to meet those dosing requirements. And I just wanted to include a picture on this slide so that make sure you understand what it means to have a scored tablet. A scored tablet is one that has a kind of line in the middle of it that's been kind of weakened at that point, which should allow the tablet to be broken relatively easy into almost equal halves. So in this case, the 25 milligram tablet is scored, which means we could be using any number of 25 milligram units. So two tablets would be 50 milligrams. One tablet would be 25 milligrams. But a half a tablet, since it's scored, we can break it along that score and actually have the patient consume one half a tablet. So we can do a half of a 25 milligram tablet, which would be obviously 12.5 milligrams. So, keeping that in mind, I think the first step in this question to kind of answer and to calculate how many of these tablets we're going to need is always with any of these questions in the textbook is to rewrite it in a way that makes sense. And this is a question that has multiple steps. Each step is relatively simple, but it's setting up the steps that you're going to need to be performed before you start doing your calculations to help avoid making any mistakes. So in this question, what I decided to do was to rewrite it in four different lines so that I knew essentially the four steps was going to be first to calculate the 50 milligrams a day for 10 days. Let's and do that. And then we'll do the 25 milligrams a day for 10 days. Then separately 12.5 milligrams a day for 10 days. And then lastly 5 milligrams a day for 10 weeks. And again, the units are very important. Obviously, in all of these questions, we have some of the dosing by days, but the 5 milligrams a day is for 10 weeks. So we're definitely going to want to take that into consideration when we perform our calculations. And then lastly, we have to go ahead and make some decisions to be able to set up the formulas here that we're going to do in a little bit. We need to make some decisions. So right up front, what I'm saying is that we're deciding to use the 25 milligram tablets to provide the 50 milligram dose, the 25 milligram dose, and the 12.5 milligram doses. So we'll need enough 25 milligram tablets to provide all of the prednisone needed to go through those three sets of doses. And then lastly, we will use the 5 milligram tablets only to provide the 5 milligram dose at the end. So with those decisions made, we are ready to go ahead and proceed on with the question. So Let's start. Again, we're going to do this one step at a time. So the first thing we're going to emphasize is let's calculate how many of the tablets we're going to need to provide 50 milligrams a day for 10 days. So my recommendation to you is to start with the 10 days. And again, I always like to use dimensional analysis so that you can see how we cancel the units. And by the end, we should have the units that we want. So I started with, as you can see in this formula, 10 days. And then I'm going to multiply that by the fact that we need 50 milligrams over every 1 day. So days will cancel, leaving me with the units of milligrams. And then I'm going to multiply that by the fact that in every 1 tablet, there is 25 milligrams. We are using a 25 milligram tablet. So as you can see, days cancel, milligrams cancel, and our final units would be in tablets. So 10 times 50 is 500. 500 divided by 25 would equal 20 tablets. And again, I put in parentheses to remind you this is of the 25 milligram tablets. But to provide the 50 milligrams a day for 10 days, we need 20 tablets. Okay, I won't go in this much detail for the remaining ones, but we just need to continue for the next section. So after those 10 days, we need to drop down to 25 milligrams a day for 10 days. So here's the same setup for the same formula, but now we're going to do 10 days at, as you can see, 25 milligrams over every 1 day. And again, time still 1 tablet has 25 milligrams. So 10 times 250, or I'm sorry, times 25 would equal 250, divided by 25 would equal the 10 tablets needed to provide those 10 days worth of dosing. Okay, the next section is to provide 12.5 milligrams a day for 10 days. All right, this might seem a little bit confusing, but let's set up the formula in the same exact way that we did for the other two. So we'll start with the fact that what we want to treat is for 10 days. And for 10 days, we want to provide 12.5 milligrams per day. Okay, and we're still using the same tablet, so just multiply that by every 1 tablet has 25 milligrams. So you have 10 times 12.5, which is 125 milligrams, divided by these 25 milligram tablets, and we see that we would need 5 tablets to provide those 10 days worth of treatment. Now, we understand that for those 10 days, the patient will only be taking 1/2 of a tablet. So make sure it makes sense to you that 5 tablets, if you take only 1/2 a tablet a day, then 5 tablets will last 10 days. So again, that should kind of make sense. So we've completed all the calculations we need for the 25 milligram tablet. So the last step would be simply to add up those 3 calculations. So the first 10 days, we need 20 tablets. The second 10 days, we need 10 tablets. And the last 10 days, we need 5 tablets. So 20 plus 10 plus 5 gives us a total of 35 tablets. And that is the final answer. That's the correct answer for the number of 25 milligram tablets we need. However, remember, we're not quite done. So the next set of calculations, or the last set, is to do the 5 milligrams a day for 10 weeks. So I will still set this formula up the same way I did the others, but you'll notice now we're going to be starting with 10 weeks. The first conversion is to convert from 10 weeks into days. So we do that by multiplying by the fact that there are 7 days over 1 week. Now weeks cancel and we're in days. Now we can proceed like we've done before and multiply by that by the fact that we need 5 milligrams every day, so 5 milligrams over 1 day, and multiply that by now the new strength of the tablet is in every 1 tablet over, they are 5 milligram tablets. So now if we take 10 weeks times 7 and multiply by 5 and divide by 5, it should make sense that our final answer when you do that math should equal 70 tablets. And now these are 70 tablets of the 5 milligram strength. So hopefully that helps you understand how to perform those calculations for that question. All right, our next question deals with calculating and dealing with drops. And there are many different types of dosage forms that use drops. Ear drops, in this case, eye drops. There are some other examples. Topical medications can be applied using drops. But in this example, we are going to be using the eye drop RESTASIS. And RESTASIS, which is a brand name for cyclosporin, is a common product used to help increase eyes' natural ability to produce tears. Because some people suffer from what they call chronic dry eye, and the chronic dry eye is often due to some inflammation within the tear ducts. Cyclosporin induces immunosuppression, so it suppresses that inflammation, and does that by inhibiting the first phase of T cell activation, a topic I'm sure you'll cover in more detail in some of your other classes, such as pharmacology. But enough of that here. Realize we are going to be administering an eye drop, RESTASIS, to help in the treatment of chronic dry eyes, to increase tear production. All right, so let's read the question. The question states that RESTASIS Ophthalmic Emulsion contains 0.05% weight per volume of cyclosporin. If a dose of 1 drop measures 28 microliters, how many micrograms of cyclosporin are present in that drop? Well, it's an interesting question. I will tell you that in terms of reading and interpreting the question before you try to run and start doing your calculations, what really needs to, I would emphasize to be aware of, is to certainly check your units again. Remember that volume of the drop in the question is in microliters. Remember that the final answer needs to be in micrograms. And then lastly, and I think the trick to this question is making sure that you understand that when you get a percentage expressed to you in weight per volume, whatever that percent is, weight per volume, I'll have you recall that a percent weight and volume expresses essentially, can be converted into the units of grams per 100 milliliters. So a weight per volume percent, the weight units are grams, and the volume is standardized in a percent to 100 milliliters. So you'll see that's an important thing that you need to know to be able to successfully calculate and answer this question. So let's start. I'll do it by going ahead and showing you my calculations down below here, and we'll kind of go through it step by step. I will tell you that where we need to start in this question with is the volume of a drop. We want to know how much drug, how much cyclosporin is in 1 drop. So we start with the fact that the drop measures or has a volume of 28 microliters. So we'll start with 28 microliters. All right. Now, looking ahead though, we know that our percent weight per volume is going to be in grams per milliliter. So the first step is to convert my volume expressed in microliters into a volume that has the units of milliliters. So you can see the first thing that I did was take my 28 microliters and multiply it by the conversion of, for every 1 milliliter, there are 1,000 microliters. Therefore, you can see the units of microliters will cancel, and I'll have a number in milliliters. All right. The next step is to convert that volume in milliliters to the weight of drug in that volume. And that's where we use the concentration. The concentration relates how much drug by weight is in how much volume. So this is what I'm saying is that you have to be able to read and interpret that as 0.05% weight per volume. Concentration is the same as expressing it as 0.05 grams over or per 100 milliliters. And by multiplying it in that way, you can see that milliliters will cancel and we'll have units of grams. We'll have a weight in grams, which is the amount of drug. But remember, the question wanted us to answer or express the amount of drug in micrograms. So the remainder of this math just shows you how I went and converted one step at a time. I converted first grams to milligrams by stating and multiplying by the fact that there's 1,000 milligrams per every 1 gram, and then multiplying again by the fact that there's 1,000 micrograms for every 1 milligram. So this last section, just by including that, will help me go from grams to micrograms. And you can see if you do that math all the way across and check all your units canceling, you should see the final and the only units left would be micrograms, and the answer would be 14 micrograms. Okay, and that's the end of that question. We'll move on to the next. All right. This next question is about oral liquids. All right, so we've talked about some medication as tablets, then we've done an eye drop, and now we're back to an oral solution, an oral liquid. Okay, now the example in this case is about Ipecac oral solution. So a little background on that is that Ipecac is actually taken by mouth to help cause vomiting, Why would you ever want to do that? Well, this is typically used in a poisoning setting where you are worried that somebody has consumed a poison and you want to try to remove that poison from the stomach as quick as possible. So you would give them a dose of Ipecac, and that would induce the vomiting. Now, Ipecac itself is derived from a plant, and as such, it's a complicated mixture of many different substances and what they call alkaloid chemicals. And these alkaloids in particular are the chemicals that irritate the digestive tract and kind of trigger the brain to cause the vomiting. So that's what Ipecac is, and that's why we would use it. So getting back to the question, it starts with the USP formulation for how do you make Ipecac. So it gives the following formula that you use a powdered form of this plant derivative, this Ipecac. You use 70 grams of that powder. You dissolve that or disperse that in 100 milliliters of glycerin. And then it says to add enough flavored syrup, AD 1,000 milliliters. Okay, I'll come back to that. Yeah, it's an important, that AD 1,000 milliliters is an important interpretation for you for this question. But to keep going on for now, it says powdered Ipecac, the actual powder you're going to use, contains 2 grams of the combined alkaloids, emetine and cephaeline, in each in 100 grams of the powder. So again, if you have 100 grams of that powder, remember there's a bunch of other stuff in this plant. It's not all these alkaloids that cause the pharmacologic effect. But in the 100 grams of powder, there are 2 grams of these active alkaloids. So we have a concentration there we'll need to use here in a little bit. And then lastly, the actual question is to calculate the quantity of the actual active ingredients, these alkaloids, in milligrams in each 5 milliliter dose of the Ipecac oral solution. Okay, so that's the question. I think we know what we need to do. Now, the last thing I would tell you before we do the math on this is an important interpretation on how this is actually formulated is that there's some extra information you don't really need for the calculations that might cause some mistakes. So in the formula, in terms of how you would make this, as I said, you're going to take 70 grams of this powder. All right, this powder is going to be dispersed in 100 mils of glycerin. Okay, so you've got your liquid right there. You could consume that, but guess what? Ipecac and glycerin would taste absolutely horrible. There's no way anyone could even swallow that. It would just be gross. So how could we make this liquid, this concentrated liquid, more palatable? Well, let's dissolve it or disperse it in flavored syrup, maybe cherry syrup, maybe orange syrup, maybe grape syrup, something that makes that gross tasting drug taste better. So we're going to dilute our 100 mils of glycerin containing it, AD 1,000 milliliters. So I would recall back to your textbook has a list of some Latin abbreviations, and in this case, AD means up to or to make a total of. So remember, we're going to take that 100 mils of glycerin and add enough syrup that we get a total of 1,000 milliliters. So the important take-home point here is that our 70 grams of powdered Ipecac will be residing in a total final volume of 1,000 milliliters. Okay? Knowing that should help understand the math that we're going to now do. All right, so let's get into solving this formula. Or this question. We need to start with, though, we want to know how much of the active ingredient is in a 5 milliliter dose. So let's start with a 5 milliliter dose of Ipecac. Okay, that's on the far left. The first calculation that we're going to do then is figure out how much overall powder, how much active Ipecac, not active necessarily, not the alkaloids yet, but just the amount of drug, powder, would be contained in that 5 milliliters. Okay, so we're going to start with the 5 milliliters of Ipecac and multiply it by the fact that we know from the formula that on top we're going to have 70 grams of this Ipecac powder for every total 1,000 milliliters of solution. So our concentration is essentially 70 grams of Ipecac per 1,000 milliliters of solution. So once we multiply that by 5, then we need to, and this is what's important, remember we didn't want to know how much overall Ipecac powder is in this, we wanted to know how much active ingredient. Remember the only active ingredients are those 2 alkaloids. So what we're going to do is multiply it by the concentration of alkaloids in the actual Ipecac powder. All right, and you remember back to the question, and as I will multiply, it said that there are 2 grams of alkaloids, those 2 alkaloids, per every 100 grams of Ipecac powder. So that's why we multiply by 2 grams over 100 grams. But this is where it's important to label your units. It's 2 grams of alkaloid per every 100 grams of Ipecac powder. Okay, the mixture of all the stuff. Okay. Now, watch the units. Starting at the beginning, 5 milliliters cancels. Milliliters cancels with the 1,000 milliliters of solution. That leaves us grams of Ipecac. Now, when we multiply the 70 grams times 2 grams of alkaloid over 100 grams of Ipecac, grams of Ipecac cancel, and we are now in grams of alkaloid, which is what we wanted in the end, but just not the right units. Remember, the question wanted us to express the amount of alkaloid in milligrams. So the last step is to multiply by the fact that in there's 1,000 milligrams per every 1 gram. So now grams will cancel, and answer will be essentially in milligrams of alkaloid. And so if you do that math all the way across, you should end up with the final answer, which is 7 milligrams of alkaloid. All right. The next question moves us into calculating doses for injections. So picture this is maybe more commonly going to be done in a hospital setting where you've got somebody with an IV line, usually kind of acute care, critical care, where drugs that are already in solution that are sterile need to be injected into the body to be able to work. And they work much more quickly, and there are a lot of different types of drugs needed in these sort of acute care situations. So in this example, the drug that they're talking about giving is Lanoxin is the brand name for the generic drug digoxin. And digoxin is a medicine that's very commonly used to strengthen the heart. So the heart can then pump stronger and more effectively. It increases blood flow and circulation through the body when the heart beats certainly more strongly. It can also be used to help control some irregular heartbeats or fast heartbeats as well. So it is commonly used, oftentimes in the elderly for things like atrial fibrillation or congestive heart failure, but even in the very young and sometimes infants that are born with heart abnormalities, they may have to use this digoxin medication to help kind of control their heart rate. So with that as a background, let's read the question. It says that pediatric Lanoxin injection actually contains digoxin 100 micrograms per milliliter. And I've shown you an actual picture of a box that does label that concentration. And the question says, what volume must be administered to provide the dose of 0.04 milligrams? So what we know is that what the doctor has prescribed and what we need to deliver to the patient is a dose of 0.04 milligrams. However, what we need to be able to tell the nurse to do is to administer a certain volume. So we're going to have to use the concentration to convert from the weight of the drug, the dose in weight, to the volume of the solution that needs to be administered to provide that dose. So we've got to go from weight to volume. And the other thing I would tell you as you're looking through these questions and thinking, okay, what am I going to have to deal with that, is also look at your units. So understand that while our final answer will be in milliliters for volume, the dose is in milligrams, but the concentration expressed for the drug is actually in micrograms. So what would we do? So let's set this up. This is not, I don't think, a necessarily complicated question, but we do need to start with, what do we start with? Where do we begin? Begin with a dose. We know how much the doctor wants. The doctor wants 0.04 milligrams. Okay, so that's where we started with. The first step, though, is looking ahead towards the concentration, which is given in micrograms. Our first step, therefore, will be to convert our weight of drug, 0.04 milligrams, and convert that to micrograms. So we'll multiply that by 1,000 micrograms over per milligram. So milligrams will cancel, and we'll have a dose that we need in micrograms. The next step is to convert the weight to a volume using the concentration. And the doctor gave us, or the product gives us the concentration at 100 micrograms per milliliter. I will say, from my experience, where these questions go wrong for many students is not knowing whether to multiply by the concentration or divide by the concentration. And it's a simple mistake to make. So when I'm going, again, I always try to do this using the dimensional analysis and let the units tell me what to do with the numbers. Again, so my units up on top still are in micrograms. So I multiply that by the fact that in every 1 milliliter, I put that over the 100 micrograms. The 100 micrograms in the bottom allows the micrograms units to cancel, leaving me the final units of milliliter. So if I'm going to take 0.04 milligrams times 1,000 to convert to micrograms, and then divide by 100 based off of the concentration, micrograms cancel and you leave me the units in milliliters. And the final answer for this question would be 0.4 milliliters. All right, the last question that I'm going to review for Chapter 7 was, I thought, kind of an interesting one, and it has to do with other dosage forms sections. So, the one I chose from here was about a topical patch. So, nicotine is very commonly used to help smokers essentially quit smoking. It helps replace the nicotine and kind of reduce their cravings to smoke. So, and nicotine is available over the counter, and pharmacists can certainly help patients select different types of nicotine. It comes as a lozenge, it comes as a gum, and it comes as a patch as well. And what's important to know to understand this question, and I've kind of shown you an image down below there, is that for the way the patches are used, is that you start people on a higher strength of the nicotine. And again, if people smoke more than 10 cigarettes a day, then they would start on this 21 milligram or this high strength patch because they've been used to smoking a lot and therefore being exposed to a lot of nicotine. So we're going to start them on a high enough dose, a higher dose of nicotine so that they don't go through withdrawal symptoms immediately. And as they get used to getting their nicotine from the patch versus getting it from smoking, then we will slowly over time reduce the amount of nicotine down to where they can go off of it entirely and not go through any of those withdrawal symptoms. So they call this kind of treatment step therapy. They start at higher step, go down to a medium step, go down to a low step, and then they're off the medication. When they're off the medication, they should be free from the cravings to smoke and hopefully be able to live a smoke-free life. So that's the background, I think, to understand this question. So to read this question, it says, a 16-week regimen for a brand of nicotine patch calls for a patient to wear a 21 milligram patch each day for the first 6 weeks, followed by a 14 milligram patch each day for the next 2 weeks, and then a 7 milligram patch for the next 2 weeks to conclude the treatment regimen. And the question asked, though, in all, how many milligrams of nicotine are administered through this entire treatment plan? All right, this is another one of those more complicated questions just because there are multiple steps. There's this for a turn, and then this, and then this. So my suggestions for all of these questions are to begin by rewriting it down by, so you know, step 1 is to do this, step 2 is to do this, and step 3 is to do this. So you can tell we need to calculate the amount of nicotine we're going to get from the 21 milligram patches that we use. Then we'll do that for the 14 milligram patches, and then we'll do it for the 7 milligram patches, and then we'll just add it all up. But really rewriting these questions in a way that help you kind of see the step-by-step process you're going to need to do the calculations is extremely important. All right, so let's begin. So it starts again with, okay, what we want to do is calculate this for the entire 16 weeks. So let's start with the fact that we know that we're going to be on 21 milligrams a day for 6 weeks. Okay. As you can see on this, as I'll go ahead and set up my formula here so you can see the math. The first problem, and really the only problem we have, is units. We have milligrams in days and weeks. And so we're going to need to start by, okay, that we're going to be on this for 6 weeks. So let's start with 6 weeks. But to be able to look at our concentration of 21 milligrams per day, we're going to have to convert weeks to days. So the first step is pretty much to go from 6 weeks times the fact that there are 7 days in every week. And then we're going to be applying 1 patch per day. So again, we go from weeks to days, and now we're from days to patch. And then lastly, we know that there are 21 milligrams per every 1 patch. So if you multiply all the way across between 6 weeks times 7 days times 21 milligrams, you'll see that the total for the 6 weeks would be 882 milligrams of nicotine. All right? Easy enough. We're just going to repeat that same process, but we've got to be careful because some of the numbers change. In the next example, the next step 2, would be 14 milligrams per day, but for only 2 weeks. So now we'll set up a very similar formula, but make sure you don't make a mistake. We're going to start again now with 2 weeks, and we're going to convert from 2 weeks to days by multiplying by 7 days per 1 week. Then we can again apply the fact that we're doing just 1 patch per day. And then lastly, multiplying by the fact that there is 14 milligrams per patch. So units cancel, and we end up with units of milligrams, and 2 times 7 times 14 gives us 196 milligrams. The last step, or step 3, is to do 7 milligrams a day for 2 weeks. So we'll set up a very similar formula, 2 weeks times 7 days per week, times 1 patch per day, times 7 milligrams per patch. So 2 times 7 times 7 gives us the 98 milligrams. So the last step to this is just to add up the individual doses of nicotine for the 3 different steps. So we'll get 882 from step 1, plus 196 from step 2, plus 98 milligrams from step 3, and that gives us a total for all 3 steps for all 8 weeks of treatment, or I'm sorry, all 10 weeks of treatment, would give us a total of 1,176 milligrams of nicotine. But the benefit to that is we are now going to be able to live a smoke-free life and enjoy all the health benefits from that. Speaking of health benefits, I hope this podcast may not have improved your health, but your knowledge a little bit, and you found it useful.